Good afternoon, everyone. Thank you for joining us today. I'm Liz Charlotte, Director of Communications at the Mississippi State Department of Health. As you all know, the COVID situation is not good here in Mississippi. This is not anecdotal. It is backed up by data. Cases are up, hospitalizations are up, ICU capacity is up, and deaths are up. So due to these facts, we are taking several new measures today. Joining me is State Health Officer Dr. Thomas Dobbs, State Epidemiologist Dr. Paul Byers, and Senior Deputy and Director of Health Protection, Mr. Jim Craig. We are all joining you from remote locations today. Thomas, let's review the numbers so that everyone can have a clear picture of what is going on here in Mississippi.
Hey, good afternoon, and thanks for joining us. As you guys know, we are seeing a really phenomenal increase in the number of cases in the state of Mississippi, and we're also seeing significant stress on our healthcare system with a lot of folks having to be hospitalized. This is not surprising. This is something we've been seeing to come for a while. It's a sort of grand combination of a low level of immunity in our population combined with the Delta variant and us being more active, and so it's entirely predictable. I do want to just sort of reinforce what we know about the transmission of the coronavirus right now. 93% of the samples that we looked at recently are the Delta variant. So pretty much everything out there right now is the highly contagious Delta variant. And we know that the majority of transmission is occurring among and from unvaccinated folks. 95% of our new cases are still among unvaccinated individuals in the state of Mississippi. But there's another thing that's happening that is new and really concerning, is we're seeing some spillover from unvaccinated folks into certain subsets of vaccinated, especially older individuals and those who have weakened immune systems. We have seen that now of our hospitalizations, 87% are unvaccinated, which is still an overwhelming majority, but we do have a minority of folks who were previously vaccinated. And if we look at our deaths, now it's 80% of our deaths are in unvaccinated, but 20% are in vaccinated individuals. And by and large, these are people over 65 who have serious underlying medical issues or have serious immunocompromised states. And that's something I'll talk about in just a second. If we look at other trends, we are concerned about increasing transmission within younger age groups. I know we shared some information that showed that we're seeing increased numbers of hospitalizations in people under the age of 50. That has been increasing significantly in recent weeks. And sadly, we are reporting the death of a 16 or a teenager in the state of Mississippi who died from COVID. We now have 4 deaths in children in the state of Mississippi, 2 in the age range of 11 to 17, 1 between the age of 6 and 10, and 1 between the age of 1 and 5. The recent death had an underlying medical issue, but it was a common medical issue. It's nothing that people don't live with every day in the state of Mississippi commonly. So this is a real tragedy and speaks to the importance of us preventing transmission. Although severe outcomes in children are rare, when we have a whole lot of transmission, we have a lot of cases, we are unfortunately going to see this type of tragedy from time to time. So very, very sad to report that. Most of the cases we are seeing is Delta, and that really is playing a part because it's twice as contagious as previous variants. So that's a super big challenge, especially when we have the vast majority of our kids who are not immune, either because they haven't had infection or they're not immunized. So going to be a big challenge going forward. And the other thing is there's been a lot of questions about boosters. We do know that certain subsets of our population, especially people who have weakened immune systems, people who are on cancer chemotherapy, transplant patients, people are taking medications because they have autoimmune disorders and have to suppress their immune system. Those sorts of folks we know do not generate significant immunity after 2 doses all the time. And that's a subset of population that we want to talk to your doctor. Right now, we're recommending that folks talk to their physician. It's a personal, it's a physician-patient conversation about what to do to remain safe. Some of it's going to be about taking precautions, but some of it's going to be seeing about, is a booster dose, which is basically just an additional dose of what you had before, is that the right pathway into the future? So stay tuned on that. We're continuing to interface with CDC to see how to move that forward, but it is something that some physicians have chosen to do in Mississippi to date, and it's something that we support as a reasonable approach for individuals in the context of a physician-patient relationship. That's all I have for my update right now, and I'll turn it over to Dr. Byers.
Dr. Byers?
Yes, thank you.
Okay.
Good afternoon, Dr. Dobbs. And I am going to share a few slides with everybody just to kind of give us an idea and reiterate some of the information that Dr. Dobbs did go over. So give me just a moment here and we'll get those up and going. And hopefully everybody can see our slides. So, you know, we are in, as Dr. Dobbs indicated, in substantial and high transmission of COVID-19, really in all parts of Mississippi. We have seen the majority of our cases in unvaccinated individuals, the majority of our hospitalizations and deaths in unvaccinated individuals. But as Dr. Dobbs indicated, we have seen breakthrough vaccination cases where individuals who are fully vaccinated may be infected, hospitalized, or in some circumstances, we've had deaths in those individuals as well. So with this highly transmissible Delta variant that we have that is circulating and causing an estimated more than 93% of the cases that we're seeing in Mississippi right now based on our surveillance data, we are aligning with CDC to update some public health guidance to prevent the transmission and control the spread of COVID-19 in Mississippi. First and foremost, that starts with COVID-19 vaccination for all eligible individuals. And just as a reminder that individuals 12 years of age and older are now recommended to receive a vaccine. That does include women who are pregnant. You know, the vaccine has been shown to be very safe and effective in pregnant women. But in addition to the vaccination, now, and again, this is aligning fully with guidance from the CDC, that everyone in Mississippi, including those individuals who are fully vaccinated, wear a mask in public indoor settings. Additionally, we're recommending that if you are exposed to someone with COVID-19, regardless of your vaccination status, that you should get tested after that exposure to determine if you have infection. We are seeing now that individuals who are fully vaccinated, who are infected, may in some cases be contagious and may be able to spread the virus to other individuals. Now, if you're not fully vaccinated, we do still recommend quarantine, and certainly if you're infected, we recommend that you isolate. But we're not recommending right now that individuals who are fully vaccinated have to quarantine. But we do recommend that they get tested after exposure to be on the safe side, to identify if there's a potential that they've been infected as a result of that exposure. We're also recommending, and these are recommendations that we had previously, that if you're 65 years of age or older, you should avoid indoor mass gatherings, even if you're vaccinated. Or if you have chronic underlying medical conditions, or if you're immunocompromised or immunosuppressed for any reason, either through medication or through medical conditions, that you should also avoid those indoor mass gatherings, even if you've been vaccinated. And let's take a look real quick at what we are seeing. As you can see, based on this data, we are having rapid increases in the number of our cases that are being reported in Mississippi now. It's a pretty astounding increase that we're seeing at the moment. And we're really not seeing that this is leveling off at this point. We are seeing deaths. We have seen some gradual increase in the number of our deaths as well. We're also seeing a higher percent of test positivity in Mississippi. So not only have we seen increases in the number of people seeking out and being tested to determine if they have infection, we're seeing a higher percent positive in those tests that are being conducted. And that's an indication as well of the burden of illness that we're seeing really in all parts of the state. If you look at a snapshot in comparison for 2-week periods between June 30th and July 13th and July 14th and July 27th, you can see an astounding increase in the number of cases that are occurring on a daily basis. 5,000 compared to over 12,000 in the most recent 2-week period. If you look at deaths, we are also seeing increases in the number of those deaths. Not to the same extent of the cases, but certainly this is also concerning. And again, as Dr. Dobbs indicated, the overwhelming majority of those deaths are in unvaccinated individuals. Dr. Dobbs did mention that our hospitalizations, ICU visits for COVID, and people on the ventilator as a result of COVID infection are also increasing. And you can see from this graph the rapid increase that we've had in the number of people hospitalized with confirmed COVID in the last month. Again, another indicator of the direction that we're heading in with COVID and with the Delta variant. We're also seeing outbreaks in our long-term care settings and nursing homes. And you can see that from low levels that we had in mid-June, we have now rapidly increased in the number of our long-term care outbreaks that we're seeing. We currently have over 100 long-term care outbreaks in Mississippi. 72 of those are in nursing homes. The primary driver of those nursing home outbreaks are infections in unvaccinated staff and employees. And regrettably, in some cases, these infections are spilling over into the residents and into fully vaccinated residents at times. So it's going to be imperative that we continue as healthcare workers and healthcare staff in long-term care settings to increase our vaccination rates among those employees, which are still below 50% across the state and lower in some facilities. Unfortunately, some of these cases in residents do result in severe illness. So we do recommend that, and we actually have a health officer order out there now that requires that all long-term care staff either are vaccinated or are tested routinely in the long-term care setting in an effort to identify those cases and remove them before transmission occurs in those settings. As Dr. Dobbs indicated, the driver of what we're seeing is the Delta variant. You can see how quickly the Delta variant has become the predominant strain in Mississippi. Through our surveillance, as I indicated, we estimate that over 90% of the cases that are occurring are due to the Delta variant, which is the primary virus that we are seeing circulating in Mississippi that is causing illness and infection. As regarding our vaccinations, we have had some minimal increase in the vaccinations over the last couple of weeks. So we hope that that's been interest from the public because of what we are seeing now with the rapid increase in cases and hospitalizations across the state. But you can see that we still have low numbers of vaccination rates in our 12 to 15 years of age group and our 16 to 17 years of age group. It's important to remember that although most times these individuals who become infected have minimal to mild symptoms and recover, there are deaths that do occur in individuals under the age of 18. There are hospitalizations that occur as well. And so we encourage all parents to get your children vaccinated. This is going to be a key to not only protecting your children, but preventing transmission in the school settings, preventing transmission into the vulnerable population, especially those individuals that they may share a household with. When we look at our vaccination rates for Mississippi, you can see that we are still lagging behind the US rates in a number of age groups. Although we're doing better in our fully vaccinated over the age of 65, we still have over a quarter of that population that is not fully vaccinated. And unfortunately, we are still seeing deaths that are occurring in that age group and in the age group over the age of 50 as well. So it's imperative that we continue to improve our vaccination as the route forward to limiting transmission of the Delta variant that we're seeing right now. The vaccine is still very effective against Delta variant. And not only is it effective at preventing illness, it is also effective at reducing the risk of severe illness. If you look at our cases, and Dr. Dobbs did mention this data, and this is updated data as of today, that 96% of our cases are in unvaccinated individuals. 88% of our hospitalizations are in unvaccinated individuals. Over 80% of our deaths are in unvaccinated individuals. And if we look at the age breakdown for these, you can see that the majority of our deaths are still occurring in individuals 50 and older, and these are largely, overwhelming majority, unvaccinated individuals. Now, the last thing that I did want to talk about was school guidance. And again, we are going to review the CDC guidance, and it's likely that we will be aligning our school guidance with CDC's guidance as well, to recommend that all students, teachers, staff, and visitors in indoor settings, in the school setting, wear a mask at all times during indoors, regardless of their vaccination status. So stay tuned. We will be sending that additional guidance out. And I'm going to turn it over now to Mr. Craig, our Senior Deputy.
Thank you, Dr. Powers. And based on some of the information that you just heard about our increase in hospitalizations and the stresses on our healthcare system, today we're issuing an order once again requiring all Mississippi licensed hospitals to participate in the Mississippi COVID-19 System of Care Plan, effective tomorrow, July 29th, 2021. In parts of our state, hospitals are struggling to accommodate the acute clinical demands that they're facing with the increase in hospitalizations. So, consistent with the COVID-19 System of Care Plan, we will enact a COVID-19 rotation to help ensure the proper assignment of patients to an appropriate hospital. Our response partners in the COVID-19 System of Care Plan have all been alerted to the order and are prepared to help us support this order. And operationally, to facilitate the order, we've activated the Mississippi MedCom. They serve as our state medical response communications facility, as well as the patient transfer coordination point. They'll begin to assist hospitals in directing patients to available beds, and when no beds to hospitals, if no beds are available, they'll start helping to rotate to destinations on a rotating basis, really based on the geography and the resources available in that area. This current order will be in effect till August 15th, 2021. In addition, this order will also look at ways to potentially increase some available resources within hospitals. Monday, August 1st, hospitals must begin to delay certain elective procedures that require overnight hospitalization. And this should increase our critical resource availability within these hospitals. And that order is also effective through August 15th currently. We'll share just a couple slides on some information about our testing. You know, Dr. Byers mentioned some of the testing that's going on in the state and what our positivity rate looks like. If we look at health department or MSDH sponsored testing requests through our scheduling system, we see that same increase in the requirements for testing that began shortly after the July 4th holiday. And we continue to see increases in testing demand in the state of Mississippi. To help with that, just as a reminder, we do have free testing or no-cost testing available to all Mississippians throughout the state. In areas where they're not private providers that are providing that testing, the health department has a contractor that's working either at our capital city location, which is the farmers market location in Weston and Woodrow Wilson, and these other locations around the state. Note that the demand has really increased at our capital city testing location here in Hinds County, and we have doubled the capacity to be able to provide for the demand in testing at that location. We also have moved Rankin County to a 5-day per week testing location to meet the demand in that particular county. We continue to monitor the testing availability throughout the state to ensure that free COVID testing is available to all Mississippians. To schedule a COVID test, you can go to covidschedule.umc.edu, or you can call the Mississippi COVID hotline. They'll be glad to assist you. Also, remember that free vaccination is now available at all county health departments during the days that they operate. It is free. If you want to make sure that your wait time is minimized, please make an appointment at covidvaccine.umc.edu, but walk-ins are also available. The reminder, we continue the effort across the state to do pop-up vaccination sites. These are kind of local short-term where we come in usually on a Wednesday through a Saturday and provide vaccination opportunities in a central area of the county, if that's identified by the county government and the officials, or in some cases is multiple locations in the county where a vaccine is made available. In all those locations, we use the Pfizer vaccine, so it's available for anyone 12 years of age and older. There is no documentation or identification that's required, and we usually come back in around 3 weeks to provide second doses in these areas. Also, while we're in the county, we try to make sure that if there are any homebound that are ready for vaccination, that we provide that vaccination opportunity, as well as institutional settings and long-term care facilities that may have additional individuals needing vaccination efforts. So if we look at our pop-up locations for this week, we find that we'll be in Clay County at the Una Community Center in Prairie, Mississippi on Wednesday and Thursday, and FEMA Voting Precinct in FEMA, Mississippi on Friday and Saturday from 9 to noon. We're also in Hancock County at their Kiln Shelter from Wednesday through Saturday, providing vaccination. In Waynesboro at the City Auditorium, Wednesday through Saturday, providing vaccination opportunities there. And in Poplarville at the Pearl River Community College, we'll be there Wednesday through Saturday as well. Finally, in Tippah County, we'll be at the Mississippi State University Extension Office in Ripley on Wednesday, Thursday, and Saturday, and at the Walnut Volunteer Fire Department in Walnut, Mississippi on Friday, July 30th. Just as a reminder, vaccination opportunities are available not just with the health department, but with a lot of our providers, pharmacies, community health centers, and other practitioners around the state of Mississippi. So vaccine is widely available in the state. Please take the opportunity to avail yourself to vaccine if you've not been vaccinated yet. I'm very, very thankful to those partners that are assisting in the vaccination efforts. Remember that vaccination is making a difference. And while it's gradual and we'd like it to be a lot more robust, please continue those efforts to get folks vaccinated. Remember also that 96% of practicing American doctors have received the vaccine. So if there are questions or you're concerned about vaccine, visit with your providers. We found that patients trust their doctors, and that's a good source of information for being able to get vaccinated. So please get vaccinated. Again, it's widely available. Talk to your healthcare provider. And Liz, I'll turn it back over to you for questions.
Thank you, Mr. Craig. I appreciate all your comments today. We have a lot of questions, so we will start with Kevin Cooper from Boo Newspapers. What advice do you give to parents of young children not yet eligible for COVID-19 vaccinations who face the potential of sending their children back to school in districts where masks will not be required by school policy. Dr. Byers, why don't you address that? Dr. Byers, I think
I was on mute. Yeah, the recommendation, and I would strongly recommend that those parents continue mask use for their children. Even if it's not required by your school district, I would certainly use a mask for your children who are not eligible for vaccination. I think that that's going to be the best protection available at that point. And we certainly would encourage, and we continue to encourage the schools to follow those recommendations that all eligible individuals should be fully vaccinated, and that there should be, with our upcoming newest guidance, a recommendation for masking in all indoor settings. But I have to tell you all that I think as we head back to school, we need to have an expectation that we are going to see cases in the school setting. We will see cases among students, and we will see cases amongst teachers. And I think it is incumbent upon all of us to put in place the full recommendations to prevent transmission within the school settings, which will include, like I said, vaccination for the eligible individuals, masking for all individuals in indoor settings, and certainly screening testing of asymptomatic individuals to identify cases early and remove them prior to transmission occurring, as well as exclusion of individuals who may be sick, certainly exclusion of COVID positive individuals for isolation, and making sure that the schools do appropriate contact tracing and identifying of those cases and outbreaks. By and large, our schools did a pretty good job last year with working toward limiting transmission and maintaining in-person schools for those schools that did in-person classes last year. I think we're set now with a more highly infectious variant that is demonstrating that it's being transmitted very quickly throughout the state. But I think if we put in place the appropriate public health measures and we follow them, then we can do things safely.
Okay, also, Dr. Byers, Kevin is following up with, can you speak to the potential benefit of having a child wearing a mask to school, even if that child is the only masked child, or perhaps one of only a handful of masked children in a classroom?
I think that's going to be an important step for those parents to take to make sure that their children are masked and that there's appropriate physical distancing in the classroom setting to make sure that we limit the potential for transmission. And I don't know if Dr. Dobbs has some additional comments on that as well.
Yeah, so it's all layers of protection. And so that's an added layer, especially for your own kid. I would say that it makes sense to maybe get a medical grade mask that's going to be more protective for the individual wearer who is using it. They're designed, they have ionic capacity within the fabric so that it'll bind germs and particles and things. So that would probably be more protective. And we're also standing ready to make sure that we can help schools have access to free masks from our warehouse capability. So, we stand ready to help. This isn't something the health department can do by itself, and y'all know that. This is something we have to do collectively. We have purview over several different areas, but when it comes to education, that's really going to be, primarily a local decision. So please make sure that your local leaders in the school know how you feel about it. That's going to be very, very important.
Okay, thank you, Dr. Dobbs. Dominique, may we have permission to record? We've gone over this several times. I'm going to ask my colleague, Stephanie Hedgepeth, to put out some information to everyone that addresses that question. In the meantime, Desiree is asking, do you think coronavirus restrictions and mask wearing orders were lifted too soon? Dr. Byers.
I think that, we were in a position at the time of decline of cases and rapidly increasing vaccination. I think with the Delta variant, it's time for us to consider some additional public health recommendations, like we've made now, in order for the public to be aware of what the risks are and what the updated public health guidance is now from the Department of Health to protect themselves and their family and limit transmission in Mississippi.
Thank you, Dr. Byers. Brad Broders with Local 24 News, ABC in Memphis, has a question for Dr. Dobbs. What is MSDH's position on whether teachers should wear masks in the classroom? What potential increased risk, in your view, is there to be around unvaccinated or ineligible yet to be vaccinated children? We've just talked about the new guidance, but Dr. Dobbs, would you like to add anything?
Yeah, sure. So I'll just reiterate that we're aligning with CDC guidance and feel that there's a benefit for everyone wearing a mask indoors. We know how very important that is. So we're going to strongly encourage every school system to have universal masking indoors.
Thank you, Dr. Dobbs. Nick Juden with the Mississippi Free Press. Governor Tate Reeves has declined to issue a mask mandate for K through 12 schools in spite of the Delta surge. And yet many school systems in Mississippi have directly stated that they will not be requiring masks unless the governor himself issues the order. Can you please speak to these risks? And then we'll take the other questions one at a time. Okay, Dr. Dobbs, do you want to start with that?
Yeah, sure. So obviously we're advocating the CDC position that that's the best path forward. And so we're going to recommend and promote universal masking indoors because we know that's an important added step that are not only going to keep our kids safe, but they're going to keep them in the classroom learning, being able to have a vibrant year. It's going to be very disruptive, all these outbreaks. And I actually talked to someone who started school already, and they said it's really been challenging because even within the first few days, they've been having outbreaks or cases. So we think it's an important measure. As far as the governor's position, obviously we would have you ask him in his office any of those kind of questions.
Thank you, Dr. Dobbs. In light of the specific assertion that they will follow the advice of the governor, how important is the governor's decision to issue or not issue a K through 12 mandate? We've kind of, I think, talked about that our guidance is to wear the mask for K through 12, vaccinated or unvaccinated, correct, Dr. Dobbs?
Yes.
Yeah, and so does MSDH have a strong understanding of pediatric ICU capacity in Mississippi? I would assume that we would. Dr. Byers, do you want to take that?
I'm actually going to defer that one to Dr. Dobbs, who I think has a better understanding of what our hospital capacity is.
Yeah, we haven't seen the pediatric ICU capacity be overwhelmed. I think it's a little bit different situation. We do see adequate capacity. I know that we feel it more as a acute tragedy when we have kids that have to go through this. I know there's a lot of interest in what the current volumes are. I don't have today's update. There's been a delay in reporting, but the report I got yesterday is there are 10 children hospitalized in overall and 3 are in ICU. I don't know how many are on mechanical ventilators, but keep in mind, this is only Mississippi hospitals. And a lot of Mississippi kids are going to go to Memphis. They're going to go to Birmingham, Mobile, and Louisiana. So this is really only going to be the subset of kids who are hospitalized in Mississippi.
And then Nick is following up with, do multiple outbreaks of Delta in Mississippi schools potentially call that capacity into question? Dr. Dobbs?
I don't think so. I mean, we'll take care of our kids. We're not seeing the same sort of stress right now. Again, it is a rare thing, but it's a tragedy. So at this time, we're not seeing that vulnerability at this very moment.
Okay, Blake, you were asking about Mississippi guidance, and so I think we've already answered that, but if you feel you didn't get what you need, just write me back and we will be happy to address that with you. Okay, Kingfish from the Jackson Jambalaya. 4 children have died of COVID-19 in Mississippi. What were their underlying conditions? Were they obese? Dr. Byers, do you want to take that?
Well, I can tell you that at least one of the individual children that we had as a death had absolutely no underlying medical problems. I think it's important to reiterate that for children, the vast majority of them do not have severe illness, but there can be severe illness, and certainly the risk is greater for children who do have underlying medical problems. And, you know, I think it goes back to what we've been saying, that if you have a child who's eligible for vaccine, now's the time to get that child vaccinated. We don't want to wait. The vaccine is safe and effective and is shown to reduce the risk of severe illness in children and adults. And so I think the real deal is that children can get severe illness. Certainly children with underlying medical problems are at higher risk for severe illness, but we do have hospitalized children from multi-system inflammatory syndrome, and that can be a significant condition as well. Vaccine is still going to be our best bet for those children who are eligible.
Can I add something to that, Liz? You know,
Of course.
we always get is what medical conditions do they have, and it kind of hurts my heart a little bit, just to be honest. You know, we want to protect everyone, but I also want to reiterate that medical conditions are very common. A potential underlying medical condition could be asthma, right? It could be eczema. It could be being overweight. It could be one of a host of very common medical conditions that Mississippians have. So let's try to protect everyone. And, you know, let's not be complacent just because we think that we don't have medical conditions, that this doesn't apply to us.
Thank you, Dr. Dobbs. Let's talk about booster shots here for a minute. So what I heard you say, Dr. Dobbs, is right now the recommendation is to speak to your physicians if you are immunosuppressed, receiving chemo or dialysis, whatever that might be. Nick is asking, many individuals are not in a position to afford doctor's visits to be tested for continuing immune responses. Will MSDH make free boosters available to those who want them without the need for potentially expensive doctor's visits? So again, who needs to talk to their doctor? Thomas, repeat it one more time. Who should talk to their doctor about a booster?
You know, so let me just, and the data is out there, it's very clear. There is research that shows that certain subsets of folks, cancer patients, transplant patients, immunocompromised people on medications that weaken their immune system, do not respond to the vaccine as strongly. And we've seen in some small studies that additional doses of the same vaccine, so booster dose right now is just the same vaccine, but additional doses can help some of those folks. This is not an FDA recommendation. This is not under EUA. This is still real early. And so there is not clear national guidance on this. This is a patient-physician decision. It's not really something that we can get ahead of the patient-physician relationship as much as some folks might like for us to. But I will say that as this evolves, and it becomes more acceptable and reasonable for us to be a resource to work with those docs, we will try to make sure that every Mississippian need has access. But right now, the data really supports for that small subset of people who do have immune compromised status because of those conditions. But
thank you, Doc. Go ahead, Dr. Dobbs.
A lot more information is going to be coming forward on this in the near future.
Thank you, though, for clarifying that. Kingfish is asking, how many children under the age of 18 die from flu or infectious disease every year in Mississippi before COVID? So flu's not a reportable disease. I'm correct about that, guys?
Pediatric deaths.
Pediatric influenza deaths are reportable, and it's certainly something that we track.
But I think we haven't, I'm sorry, Dr. Byers, we haven't had a pediatric in what, 3 years?
Our last one was actually in 2020. And, you know, going back to 2016, we've had 9 pediatric influenza deaths. And, you know, flu is one of those conditions that can impact children. And it's one of the recommendations and one of the reasons we recommend that children get influenza vaccine as well, because it is a preventable death.
Dr. Byers, also, the other part of Jimmy's question is infectious disease. Every year, that would be something we would certainly have to look up, all the reportable diseases. That's not something I don't think you know off the top.
Very broad thing.
Yeah,
but they're still not very common. I mean, meningitis and some other things could happen, but from communicable diseases that we think about, unfortunately, it's quite uncommon.
Okay, thank you. Will Stribling from Mississippi Today. On stress to the healthcare system, I know bed ventilator capacity is a big part of it, but are staffing levels playing a role as well, which we know that is taking place, especially with our nurses. I know Mississippi has lost many nurses over the past year who have pursued career opportunities in other states. Dr. Dobbs, would you address this?
This is an enormous part of our challenge. And this is one of the reasons why I think that this phase of the pandemic, this Delta surge, is going to be more challenging than any before from the hospital resource perspective. We're seeing the most rapid increase in cases and hospitalizations. It's coming on the time when we have a lot of other medical issues that are going on with folks, and we have shortage of staff, specifically nurses. So that is a huge part of it. It doesn't have an easy solution. And we have, in many ways, absolutely worn out our health professionals, especially our nurses. And I hear from nurses every day who say, I'm just so burnt out. I can't believe we're having to go through this again. And in a way, I'm sad to say that I think we're driving some nurses away from inpatient hospital work because it's so exhausting. And this is, the fourth wave of hospitalization and death we've seen. I mean, there's only so much that we can expect for people to put up with, and we're putting a lot more stress on them now. I think it's going to be a super big challenge, and just want to thank them for being the heroes they are. Okay,
thank you, Dr. Dobbs. Let's see. Okay, Laura, she wants to know about breakthrough cases. Can you do a comparison, Dr. Byers, maybe looking at the comparison of breakthrough cases and those that are unvaccinated? Obviously, the larger number is those that are unvaccinated, but do you have that data ready?
Yeah, well, as you said, the overwhelming majority of cases are in unvaccinated individuals. Well over 90% of all of our cases are in unvaccinated individuals. We've had over 1,000 breakthrough cases reported to us to date. But if you put that in comparison with the thousands and thousands of cases that we are reporting on a weekly basis, you can see that the difference is that we are still seeing the vast majority of our cases in unvaccinated individuals. And again, as we looked at that data, the majority of our hospitalizations and the majority of our deaths are occurring in unvaccinated individuals. But again, the problem is that we are seeing so much transmission right now, such high levels of substantial transmission throughout the state, and with a highly infectious variant that is twice as infectious as any previous variants that have been identified, that we are having spillover into individuals who've been fully vaccinated. And remember, when we look at those individuals who are vaccine breakthrough deaths, those individuals who've been fully vaccinated who have died, the majority of those have been in people who have had some underlying immunocompromising condition and have been in older individuals. The best way to protect those folks from vaccine breakthrough is to limit the transmission. And the best way to limit the transmission starts with vaccine, but also to follow the additional public health guidance that we've said.
Thank you, Dr. Byers. Jim Craig, Mr. Jim Craig, I want you to answer this. Can you speak to hospitals becoming overwhelmed, where we stand now, what we may see down the road if the cases and hospitalizations continue to climb? Jim, would you take that?
Sure, Liz. No, great question. We are seeing some areas of the state where our system is already taxed. We just have Patients that would normally be in an ICU are having to be bedded in an emergency room because the ICU beds are full right now. As you might expect, with increase in hospitalizations, is increase in those resource needs. Regular healthcare is still going on, so the regular demands every day. A lot of hospitals are fairly full on a daily basis without increased case numbers that we're seeing right now. So, I think that we will continue with the case numbers this high, seeing hospitalizations increase over the near term. So hospitals, as part of their processes, have emergency operation plans to be able to flex to a degree, but just know that one of the reasons the COVID-19 system of care has been enacted is to help them in those emergency operation plans to be able to move people around to other locations so that we can care for everybody as best as possible. But, the best thing is not to have to go to the hospital. And the best way to do that is not to be a case. The best way to do that is do all the things we've been talking about to try to limit your exposure.
Thank you, Jim. Let's see. Anna Snabes with the Meridian Star. Do you know when MSDH's weekly variant report will come out this week? Typically, it does come out on Tuesday, and I don't know why the delay, but I'm even wondering if there's a need to do it when we know 93% of our cases are the Delta variant. Paul, do you have anything to add to that?
No, and certainly we have almost 700 cases identified of Delta variant in the state. But that's not the number that people need to hone in on. The reality is through our surveillance data, more than 90% of all of our cases across the state are Delta variant, which means that, and that's through our estimation from our surveillance data, which means if you have COVID, you likely have the Delta variant in the state. Certainly we can look to updating that chart. But I think we all need to understand now that the predominant strain in Mississippi is the Delta variant. That's what's circulating. That's what's causing the illness.
And probably the most dangerous variant so far, would you say, Dr. Byers?
Certainly the most infectious.
Yes. Okay, let's see. Leah from AP, can you tell us around when each of the 4 children died? I don't know if we have that readily available, or if the Delta variant was a part of those.
We had 2 that died in 2020, and so far we've had 2 children die in 2021, and certainly those earlier deaths that we had were prior to the emergence of the Delta variant. But again, for recent cases, for recent hospitalizations, for recent deaths, the likelihood is very high that what we're seeing in those cases are Delta variant.
Thank you, Dr. Byers. Courtney Ann, I think we have answered this. We have changed our guidance. Write me back if you didn't get everything you needed on that. Sarah from the Clarion Ledger, what are the locations where there are large numbers of COVID cases in long-term care facilities? Dr. Byers, do you want to take that?
I don't have the locations at the tip of my fingers, but guys, we're seeing this statewide. It's not in one particular area in the state, and all long-term care facilities, especially those with lower vaccination rates among the employees and staff, are at risk for outbreaks in those settings. Unfortunately, that's the landscape that we're in right now. Many of y'all remember during the previous worst part of the pandemic to date, we had somewhere in the neighborhood of 150 plus nursing homes throughout the state that had active outbreaks at any one time. And, now we've got 72 nursing homes that have active outbreaks, and we expect that number to grow. And we're just seeing that really in all parts of the state.
Can you talk more about what's being done to encourage vaccination among nursing home caregivers? So we put guidance out, I think about 2 or 3 weeks ago, requiring testing of those that were not vaccinated. Is there anything MSDH can mandate for the public outside of its institution? Dr. Dobbs?
Yeah, so with the long-term care setting and nursing home, I want to reiterate that most of the cases are actually employees and staff, and so who are unvaccinated. And we are seeing cases in the residents also, tragically, but the vaccine's making a difference. I mean, our nursing home situation is challenging, but it's so much better than it was because we've been successful at vaccinating the majority of our residents there. We do try to support the nursing home staff getting vaccinated, and we'll make it available and go out there and do it. Anything we can, we're going to make the vaccine available. But, there's a mountain of opposition to us from some folks, and it's not a Department of Health thing. This is an entire state of Mississippi thing. So if you're not pushing back on the vaccine disinformation, if you're not pushing back on people who don't think it's important to protect others, then we're not going to succeed collectively. And then the second part of that question was about the mandates. We have clear lines of authority that we can work with, and we'll do that. We have authority for isolation and quarantine orders, and we do that individually. We still have an active health officer order that if you are a case or a contact, you have to isolate or you have to quarantine. And we do over institutions over which we have regulatory authority. But by and large, general things that are outside of those mandates, we do not, or outside of those sort of lines of authority, we do not pursue broad mandates.
Thank you, Dr. Dobbs. Isabella from the Sun Herald, could you talk about a specific example of a COVID outbreak among children? In the past, there was mention of a youth van outbreak. Has there been a super spreader lately, Dr. Byers?
Yeah. Hey, guys, we're seeing outbreaks everywhere. So anywhere that unvaccinated individuals are getting in group settings, we're seeing high levels of transmission that's occurring. So, we're covered up with outbreaks, and we're identifying them in all sorts of gatherings. Certainly, as the summer progressed, we have seen outbreaks among children getting together for band camp or for school enrichment programs over the summer or for cheerleading camp. And it's not just limited to outbreaks among children. We're seeing outbreaks really in any social settings. We're seeing outbreaks where individuals gather who are unmasked and unvaccinated, and transmission is occurring. And I'll tell you, one of the things that we're seeing with the Delta variant is, opposed to some of the other strains that we saw previously, where the transmission may be limited to a handful of folks and those individuals who share the home with the case, we're seeing broader transmission. We're seeing just high levels of transmission that's occurring with the Delta variant. And it's really just due to how infectious it is and how easily it's spread.
Okay, thank you, Dr. Byers. Shalina, I think we have answered most of your questions. We've talked about the booster. We have talked about strategy, and as was mentioned by everyone, it's not just a public health effort. Everybody needs to be part of encouraging vaccine as the right thing to do. Let's see, Shalina, write me back if you have anything further, because I know we've talked about the boosters. And so write me back if you have anything else. Kelly Roberts with WMC. Can you tell us where the teen who recently passed away was from? No, we cannot. When it comes to a booster dose, are vaccination administrators in Mississippi authorized to give third doses? I think we've talked about that, but and by the way, the reason we can't, Kelly, we don't give identifying information. That's part of HIPAA. And so we err on the side of being conservative. So we don't give any information like that. I actually had a reporter yesterday ask me for the name and address and age and so on and so on. You all know HIPAA, and we are on the conservative side, so we can't give any identifying information. I think we've talked about, when it comes to booster dose, our vaccine administrators in Mississippi authorized to give third doses. I think we've already talked about that, who third doses are recommended for, and to talk to their physicians. Finally, Governor Reeves says he will not mandate masks even in schools after CDC guidance. Does the MSDH have any authority to issue a mandate, or would it choose to do that? We have issued guidance along with the CDC guidance. Gentlemen, would any of you like to say anything else to Kelly?
You know, that's orders for the schools is outside our traditional mandate structure. So I think that'd be pushing the limits of our authority. You know, again, you know, this is not just a Department of Health response, right? I know everybody asks us what we're going to do. Even today, some institutions and some other, like, you know, non-healthcare folks are like, hey, we're in trouble. What are you going to do? Y'all, there's not everything we can do. This is an us thing, right? We have gotten ourselves into this mess together, and we need to get ourselves out together, and we need to take full advantage of all the effective tools that are available to us. We know what they are, but we need to do them collectively, and we need to do them in a manner that optimizes the well-being of our populace, keeps our kids in schools, keeps our health system vibrant, and helps as many people get through the pandemic as possible.
Thank you, Dr. Dobbs. Jasmine from Twin State News. Does Mississippi have a county by county max with vaccination rate and CDC levels and community transmission? I'm a little confused by a part of that. Dr. Byers, do you have that? Or can you address it?
Well, certainly we post the vaccination rates by county on our website in our daily vaccination report. And we do have those listed for both individuals who initiate vaccine as well as individuals who are fully vaccinated. And I will share a slide with you, if that's okay, because I want to show you the levels of high and substantial transmission in Mississippi. And this is from CDC's data as well. And if you look at the map, you can see where Mississippi is, and it's pretty much covered up in high levels of transmission and substantial levels of transmission in all counties in the state. Our highest vaccination rates among our counties are in the 40% range. And, you know, that's good. There's been some improvements, but that's not at a level that at this point is preventing the person-to-person community transmission that we're seeing in all settings. And I don't know if Dr. Dobbs wanted to jump in on that one as well.
The only thing I'll add is we have done some preliminary analysis of transmission rates and vaccination levels, and there does seem to be a county by county correlation with lower vaccination rates and higher transmission.
Thank you, Dr. Dobbs. Shalina is asking from NPR, where are you seeing COVID-19 outbreaks? The answer is everywhere. Am I correct? Everywhere, Shalina. It's not just in a few different areas. Of course, it's in congregate facilities. We've talked about long-term care facilities, and we do assist jails. We give guidance for jails and detention centers. What's the guidance for those areas, and how are you monitoring outbreaks in these places as the Delta variant surges? So, Dr. Byers, you work a lot with the detention centers. Why don't you take that? What's the guidance for those areas, and how are you monitoring those outbreaks?
Yeah, you know, we're monitoring the outbreaks through the same process that we normally monitor outbreaks that we have throughout the pandemic. And certainly we work closely with detention centers and correctional facilities, as well as as other facilities where there are outbreaks to provide guidance on testing, to identify contacts, guidance for vaccination strategies, and provide support for those efforts. We provide support for testing efforts. We provide guidance on masking and isolation and quarantine. And, you know, we continue to work with those facilities. And as Delta variant has increased across the state and our cases have increased, certainly we've seen a growing number of outbreaks in, like we said, in all settings. I didn't know, Jim,
Go ahead,
have some additional info on that.
Jim.
No, Doc, I think you covered it really well. But really in all those congregate settings are those opportunities. The Delta virus is just so easy to catch and so contagious that it is important for those facilities to really take the protective measures in place.
Thank you, Jim. Lauren from the Sun Herald. I think can you share the latest numbers on kids under 18 in ICUs and on ventilators? Dr. Byers, did you share that?
I did. You know, it was 10 hospitalized yesterday. I don't have today's, but 10 hospitalized yesterday, 3 ICU. And that's only for Mississippi. It doesn't include kids who are hospitalized in border states.
Thank you. And we will place the charts, Lauren, all the charts that you see, we will place on our news and events page where the press conferences are also posted. So they will be there. Let's see. Brad from 24 News. Has MSDH sent notices to doctors' offices and hospitals offering guidance on whether to delay certain procedures? Yes, we've already talked about that. I think you probably wrote that before we talked about it, but certainly a health alert network was sent out communicating with doctors, and we had the health officer's order as well. Let's see. Craig Ford, can you summarize the orders issued today to hospitals concerning elective surgeries and the coronavirus patient rotation and what this will, okay, he said we can disregard this last question. All right, so Craig, if you need anything, just write me back. All right, Courtney Ann from LBT, what is your message to school districts who currently put out reopening plans that have masks optional? Do you have a concern about the masking piece being a district by district decision? I think we talked about that and we issued guidance and in the end it's up to the districts. Dr. Dobbs?
Yes, we think that everyone should mask indoors and that's our guidance, and we'll try to promote that because that's the safest way for our kids not only not to catch COVID, but to stay in the classroom and to have a successful, healthy school year as we're negotiating COVID. I'm not saying this is going to be something that lasts throughout the whole school year, but right now, with the highly contagious Delta circulating and the vast majority of kids non-immune, it's a perfect recipe for transmission in the schools.
Thank you, Dr. Dobbs. Let's see. From Kingfish, Dr. Scott Gottlieb expects the Delta outbreak to subside in 2 to 3 weeks. Do you agree with this assessment? I will start with you, Dr. Dobbs, since you're shaking your head.
I do not. We're seeing a massive rise now, and then school's just getting started. It's hard to, you know, we're just, if you look at the trajectory of our rise, it's not a slope, it's a cliff. It's an upward cliff. There's no turning downward. So it's hard to foresee that this is only going to last a couple of weeks.
Dr. Byers?
No, I agree with Dr. Dobbs. We'd love for it to be gone in 2 to 3 weeks, but I think that's unrealistic. I think with the amount of transmission and the rise in the number of cases that we're seeing right now, that we're going to be in a tough time for a while now.
Okay, thank you, Dr. Byers. Hunter is asking, is there any chance that all state employees are required to be vaccinated similar to the steps other states are taking? So, Dr. Dobbs?
You know, I would think that's going to be hard pressed that that's going to happen for us. just like other things, we certainly recommend everybody gets it, and we'll take certain measures to protect folks who are unvaccinated and to prevent transmission. We have gone to universal masking at the health department. We have been doing that for a week or so already, understanding the risks. So we'll continue to give people the guidance to that effect, but I don't anticipate there being statewide mandates for employees.
Dr. Dobbs. Caroline from WDAM, are there any commonalities among breakthrough cases? Dr. Byers?
Well, we have seen some common themes among the breakthrough deaths for certain, with the median age of 79. So it's in older folks that we're seeing the breakthrough deaths. Certainly, 58% of them have had those significant underlying medical problems that may put them at risk for immunosuppression. We have seen breakthrough cases in all age groups, but where we have seen the impact of severity of illness has been by and large in those older individuals who are immunocompromised.
Thank you, Dr. Byers. We, for those that you were asking, there is a message out there how you can tape our show. It will be available on YouTube a little while after it's done, but go ahead and take a look at that, and that should help you. We've put that out before. Craig Ford from TVA. I know the focus now is on the Delta variant. What do you know about the Gamma variant? How much worse could it be than what we are now seeing with the Delta? Dr. Byers?
I think it's uncertain right now. Certainly, we've identified some Gamma in Mississippi. We haven't seen it transmissible in the way that we've seen the Delta variant take over. I think it's been pretty astounding how rapidly Delta became the predominant strain in Mississippi, and that's primarily because of how infectious it is. I think it's important to understand that as we continue to have high levels of transmission, we may have additional variants that emerge. The more that the virus is out there circulating and causing illness, I think there's certainly more chances that we'll have another variant strain that emerges that may be more deadly, may be more transmissible, may even escape the protection from the vaccine. I think that we're going to have to wait and see how that plays out. I don't know if Dr. Dobbs has some additional guidance around that or not.
Dr. Dobbs?
We're not sure. We just know, Delta's pretty nasty.
Thank you. Hunter, I think you're talking about boosters, but write me back because I think we've already answered that. Write me back if I'm wrong. Sarah with Y'all Politics, is there any new or additional information regarding pregnant women and the impact COVID could have on the mother or baby, particularly in relation to the Delta variant we are now seeing? Dr. Byers, you talked about how it was safe for pregnant women to get the vaccine. Do you have any additional information?
Certainly. I can tell you that we have seen cases among pregnant women. The overwhelming majority of those cases that we have seen have been in unvaccinated pregnant women, certainly since the vaccine has been available. We have seen some deaths in pregnant women due to COVID. It's been minimal. I think we've had 4 deaths to date in pregnant women identified due to COVID. And those were prior to the vaccine being available. I think that the vaccine is going to be continued to be an important strategy for protection in pregnant women. We know that the vaccine is safe and effective in pregnant women, and we do know that there is a risk for pregnant women of severe illness, and that there's a risk of transmission to the infant after being born. And I know that Dr. Dobbs has looked at some additional information on the effects of COVID and pregnancy as well.
Dr. Dobbs?
One of the things that's really frightening is there seems to be a very strong association with COVID or previous COVID and preeclampsia, which is a dangerous medical condition. So it's something that we're learning more and more about. But COVID is just not good for you. I mean, it's a bad thing, and you want to keep from getting it. We do know it makes it's dangerous for pregnant women. And we know that it can have adverse outcome if we're looking at increased preeclampsia. So stay tuned. There'll be more and more information coming out, but I know there are some studies that show that association.
Okay, thank you. Nick is asking from Jackson Free Press. As we see the pandemic grow in younger individuals, what is MSDH's current understanding of the prevalence of long COVID? Dr. Byers?
Yeah, we don't have clear information on the prevalence of those individuals who have long COVID or who may continue to have persistent symptoms. And so we do not have that information at this point.
Okay, so I think that answers the second part of Nick's question. What percentage of individuals develop persistent symptoms post-infection, and what do you estimate the long-term impact of this new surge may be? So I think we answered that, Dr. Byers.
Well, and certainly the impact of the new surge is when you increase cases and the more people that are being infected, certainly there's a possibility that you're going to have more people who are affected by those long-term consequences as a result of COVID-19 infection as well.
You know, that's always what has scared me about COVID. And I've talked to so many people that actually are suffering some of those long-term effects. And that is, we really don't have any information on how long those will last, do we?
It's a bad disease, man.
It is. Okay, let me see. All right, Courtney Ann, this is a good question. Do you have a number on how many school districts in the state have agreed to be part of the school-based COVID testing initiative? Dr. Byers, that's you.
Yeah, I do. I know that there are 22 school districts and an additional 2 schools that have already signed up and completed the process to receive testing, to do school-based testing. We've had another number of school districts that have expressed interest and are in the process of completing the paperwork to be able to receive those tests. Additionally, we will be working with a vendor that will be able to provide the on-site testing for those schools that are interested without a requirement for the schools to have to do the testing. And so we do have that information out there available. We have communicated that to the schools. It's important to understand that the testing of asymptomatic individuals to screen them for COVID infection is another tool. It's another layer of prevention in the school settings to try to keep them in-person class. And, you know, I think as we progress through the school year, it seems we're having more and more schools expressing interest.
Yeah, the number's gone up quite a bit from the last time we talked about, I think it was 12. So how often, Dr. Byers, would they do this testing if a school signs up?
You know, we're recommending that they do screening testing for all asymptomatic, unvaccinated individuals. That's both teachers and staff and students on a weekly basis in an effort to identify those individuals who may have infection but haven't shown symptoms yet, in order to have them not at school and limit transmission and catch them early in the course of their illness. So we're recommending that testing be done at least weekly.
Thank you, Dr. Byers. Sarah from the Clarion Ledger. Jim Craig, you may know this because you're always looking at the numbers. How many ICUs in the state are at capacity?
Yeah, you know, obviously that number changes from moment to moment,
Right.
but the snapshot that was done last night, there were 28 hospitals reporting no ICU bed availability, and many of those were our larger facilities in the state.
Thank you, Jim. Nick is asking, for those concerned about additional variants, can you discuss the concept of peak fitness? Is there a limit to how infectious a new variant can get? Dr. Dobbs, what's peak fit? First of all, discuss peak fitness if you could.
I think I know what he's talking about is like, you know, what are the optimal scenarios and how it can spread. And sometimes that'll interplay with pathogenicity and stuff. I'm kind of reluctant to really even speculate on it, you know, as far as how contagious it can get. we do know the sort of the boundaries for different types of viruses, and the most contagious we know of is measles and smallpox, which are the most contagious, but they spread in a very different sort of way. So, with a primary droplet with occasional aerosol, it's not going to be quite as likely as the measles and the smallpox sort of situation. But I'm reluctant to speculate because I really am not sure.
Okay, thank you. And we have Tynesha Jackson from WTOK. Can you speak one more time about the ordinance that will be taking place tomorrow? I wouldn't really call it an ordinance, but Dr. Byers, do you want to go over that again?
I think she may be talking about the
Health officers?
the health officer's order for,
Yeah.
for the crisis of care.
Right.
And Jim may want to reiterate that for us.
Jim,
You
can you
bet.
do that?
I can. So effective tomorrow, on the 29th of July, the order will be in place to begin rotation and mandatory compliance with the COVID-19 system of care plan for all of the hospitals in the state. And that rotation will help ensure the proper assignment of patients to appropriate levels of care. It'll also include the elective procedures that require hospitalization to be delayed through August the 15th, beginning Monday. We did visit a little bit with the medical community, as well as sending out the HON today to let them know of these elective procedures needing to be delayed, and that will start on Monday. And both of those orders are through August the 15th.
Thank you, Jim. It looks to me like we have asked all the questions. Anyone have any last questions? Or if I didn't quite get your answer, well, here we go. All right, super talk. Let's see. There seems to be a large portion of the population that is firmly against government agencies issuing new recommendations, especially as it relates to masks and vaccinations. What strategies can be deployed to get through to them? If we knew, we would be employing them. I think it's a not just a health department thing. Everyone has to get on board. But Dr. Dobbs, what do you have to say?
This is a huge challenge, without a doubt. And we're fighting a social media monster that's been fed with just really endless amounts of misinformation. And most folks out there who are reluctant are just unsure. We need to make sure the unsure folks know how to make the right decision. And that's the main thing we can do, is try to speak the truth about what's going on. Even if people don't like it, that's our job. We know it works. We know what masking works. It's going to keep our kids in school. Let people make the rational decision if they want to have a successful school year. Right now with Delta, we're not saying kids don't have to wear masks forever. We're not even saying kids have to wear masks. We're just saying that they should. So just trying to make sure that they understand the proper argument. The other thing is about the vaccination bit is we get a lot of feedback from folks who say it's a personal decision. And certainly we get that. And say it's not your decision to say whether I should get COVID or get the vaccine. But I think it's important for us to make it very clear what the implications are. Especially with the Delta, I think it's even more abundantly obvious that you will either get the vaccine or you'll get COVID. And if you haven't had COVID before or you haven't been vaccinated, you're very likely to get the Delta variant in coming weeks. And what does that mean? Well, it means, yes, you might get sick. Most young folks will get over it just fine, but there are some bad consequences. But the part we don't talk about it is the people that you're likely to give it to. On average, with the level of immunity we have in our population and the contagiousness of Delta, if you catch it and you're not immune, if you catch it and you haven't been vaccinated and you're contagious, you're probably going to give it to 3 people on average. So who are those 3 people you're going to give coronavirus to that you didn't plan on giving it to, right? Because it happens before you know it. You're contagious before you even know you're symptomatic. And that's the real challenge here, because we're all in this together. And if we would all just sort of really look at what the science says, look at what the data says, and understand how safe the vaccines are and how beneficial it is not only to ourselves but our communities, we could come out of this. And, we'll keep trying to share what the true reality is of what's going on. We're not forcing anybody to do anything, but we'll do all we can to push back against misinformation and to make sure people have the best information to make the best decisions for them and their families.
Thank you, Dr. Dobbs. Let's see. Leah with AP is asking, oh, Jim, can you repeat how many ICUs are at capacity of COVID? And Jim, also, do you know how many there are in the state total?
I'll have to get you the total number in the state because that number does fluctuate as well. An ICU is the physical space, but it's also the practitioners organized to be able to provide that care. And those numbers fluctuate in facilities based on the need. But right now, the snapshot yesterday reports that 28 of our hospitals had no ICU capability.
Okay, thank you. And in your experience, Jim, have you ever seen it like that before?
This is as bad as what we saw in January, and the reason for the health officer order for us to reinstate the COVID-19 system of care so that we can make sure patients are moved around. But it is very alarming that we are having the bed patients that are normally in an ICU in an emergency room again. We saw that during the wave in January, and it was very stressful to the hospitals. Those same nurses that we're talking about that are in short supply are those same nurses having to try to do this again. So we're seeing a lot of stress on the healthcare system right now because of the Delta variant and because of the level of transmission we're seeing in the state.
Thank you. And I think it's also stress for families if their loved one can't be placed somewhere close to them. I mean, we had to transfer out of state, I think, back in December and January.
And we're seeing, other states trying to transfer to Mississippi too. So it is, and that's part of a normal referral pattern and not necessarily COVID. Remember that heart attacks and strokes and all the other things that normally go on in the healthcare system are still going on in Mississippi. So those normal people that we would see in the ICU are still there, plus now these additional COVID patients. So that's really a lot of the stress that we're seeing on the system right now.
Jim. Kevin Cooper from Boone Newspapers. Dr. Dobbs, does the quote, get the vaccine or get COVID idea apply to unvaccinated children too, in your opinion? Is it inevitable that our children are going to get it at this point? Thanks. So Dr. Dobbs, first, why don't we address the get the vaccine or get COVID idea as far as it applies to unvaccinated children?
We know how to diminish risk. And so, and obviously this isn't like a point in time sort of conversation. This is an over the pandemic sort of thing. So about a quarter of our kids have already had COVID, but about 3/4 of them haven't. So that's a lot of folks who are still vulnerable. What we should be trying to do is minimize transmission now while we're having the Delta surge, build protective cocoons around our kids, because if the people who are around them are vaccinated, then that's going to diminish transmission. Wait until a vaccine's available, right, for those parents who want to get the kids protected with the vaccine, and give us time to get past this. I mean, I do think we can protect our kids. It is going to be a challenge, but this is a team effort, right? This is a family affair. This is going to take all of society trying to protect our kids, because if we don't, I do think we're going to have a lot more kids getting COVID. And, most kids will get over it just fine, but some are going to have a lot more trouble. And there are simple things we can do to minimize transmission and to maximize school attendance. And, we're going to try to help folks do that.
Well, Kevin is also asking, Dr. Dobbs, would delaying school openings help?
Till when? I mean, it's been out there. We've got to educate our kids. I think we've all come to that, realization that the kids have suffered for not being in school. We do know that if we do it the right way, the risks can be minimal. It's just a matter of us choosing to do it the right way. And we talk to our schools constantly. We learned that if you have kids in structured settings with a little bit of space and a mask on and a little bit of planning, you can prevent COVID transmission, really very, very efficiently. But if you ignore it, COVID's going to take advantage of that lapse.
Yeah, we're going back to wearing masks. We went back to wearing masks at the health department. Vaccinated or not, everyone wears a mask. I don't see any more questions at this time. This is probably the most serious we've been since, a serious situation we've been since December and January, December of 19 and January 2020. Or I've got my dates wrong, but y'all know what I'm saying. And I'm just wondering if each of you could just leave us with one important thought, because we have a lot of Mississippians who are going to get sick, who are getting sick, and the situation is simply not good. So Jim Craig, start. How do we resonate with people? Give me something that will resonate with people on the current condition.
Well, you know, our hospital system is fairly finite. There's a finite resource of people and staff and spaces to be able to take care of the regular things that happen in healthcare every day, the strokes, the car wrecks, all the other things that are just part of normal healthcare in Mississippi. And the additional COVID cases are going to put additional stresses on our hospital system. We're already seeing it. We're already seeing the results of that. And know that, as Doc said, for each one of those cases, there's additional folks that could be exposed and can become the next case. So that continues to increase those hospitalizations. So we have a lot of healthcare heroes, both in our nurses and physicians and other caregivers that are doing their best to try to help during this pandemic. Please, everybody, do your part to help them be successful in protecting you.
Thank you, Jim. And the dates I think I was trying to go for was December 20 and January 21, when things were pretty stark, looking pretty bad. Dr. Byers, your final word of advice.
Yeah, thanks, Liz. And certainly I agree with Mr. Craig as well. Look, guys, we're in a bit of a tight spot right now with our increases in our healthcare pressure that we're seeing, but we do have some tools available to us, and we really want to encourage folks to pick those up. And if you're eligible for vaccine and you haven't been vaccinated, please go ahead and get vaccinated. That's going to be the best protection for you and your family. I encourage everybody, all Mississippians, to do that. But use the other tools that we have out there as well. You know, we are recommending masking in public indoor settings. We're going to be recommending masking in school settings, indoors for all folks, regardless of vaccination status. If you're infected, if you find out that you're infected, isolate. Do your part to limit spreading it to other folks. If you're exposed to somebody who's got COVID, get tested, find out if you're infected. And if you find out you're infected, isolate. If you've not been vaccinated and you're exposed, quarantine. Make sure that you don't give it to other folks. I think we've said these tools before. We've had all of this in our arsenal before. I think we really need to pick it back up and use those tools. We're going to see increases in cases, I think, over the next little bit, but we need to do our part collectively to get us out of the situation we're in right now.
Thank you, Dr. Byers. Dr. Dobbs, last words on the current situation we're in.
You know, the only thing I'd like to say is how much we appreciate the heroic work of our healthcare heroes, of our docs, our nurses who are going to be working through this phase. They're exhausted, but they're ready to stand up and meet the challenge. But it's going to be a challenge unlike any we've seen. I know that sounds kind of remarkable, but it's the truth. The other thing I want to say is, if you're in a health system, be patient. It's going to take you a lot longer to get your care. You may be in the ER twice as long as you're used to, or you might not be able to get as ready a response in the hospital bed because the nurses are so stressed. Or it may well be you're transferred to a hospital or your family's transferred many hours away. That's just the inevitability of where we are. So thank your healthcare heroes. Please don't be frustrated with them. They're doing everything they can to keep you alive and keep you healthy. And just be prepared and be patient, because it's going to be a rough few weeks.
Thank you also to the media for working with us to get out accurate scientific information. We need y'all, and we appreciate you guys each and every day. On behalf of Dr. Thomas Dobbs, Dr. Paul Byers, and Mr. Jim Craig, I'm Liz Charlotte, wishing you a good afternoon.